You go to a doctor and describe the pain. The doctor examines you, asks questions, prescribes something. You walk out with medicine. We treat this as normal. But medicine is not normal. It is one of the oldest things humans ever did. Older than writing. Older than farming. Older than civilization itself. And it did not begin with us. Neanderthals, the species we spent centuries calling primitive, performed surgery, used painkillers, applied antibiotics, and drilled teeth. Long before any of us existed, the oldest confirmed surgery happened in a cave in Borneo. 31,000 years ago, a child, somewhere between 8 and 14 years old, had their lower left leg removed. Not accidentally, surgically. The bone edges of the remaining tibia and fibula show clean, rounded remodeling. No infection, no jagged trauma, no signs of a wound left to close on its own. This was deliberate, planned, executed. Published in Nature in 2022 by an international research team, the find pushed back the known origin of complex surgery by 24,000 years. But the surgery itself is only half the story. The child survived for 6 to 9 years after the amputation, in a mountainous tropical rainforest, with no mobility aids, no antibiotics, no sterile environment. The surgical team had to prevent fatal blood loss from major arteries. They had to manage infection in one of the most pathogen-dense environments on Earth. And then the community had to carry this child for years, feeding them, protecting them, choosing not to leave them behind. That is not instinct, that is medicine, and that is care. In 2017, researchers analyzed the dental plaque of Neanderthals. Not their tools, not their bones, their teeth. Specifically, the calcified plaque that had hardened onto their teeth 50,000 years ago. Inside that plaque, they found DNA, the genetic signatures of everything the individual had put in their mouth. One specimen, El Cedron 1, from a cave in northern Spain, was suffering from a severe dental abscess and a gut parasite. He was in pain, he had an infection, and his dental plaque contained poplar bark. Poplar bark contains salicin. When you digest salicin, your body converts it to salicylic acid, the active compound in aspirin. His plaque also contained Penicillium rubens, a mold that produces penicillin. The same compound Alexander Fleming would accidentally discover in 1928. A Neanderthal found it first, while sick, in pain, in a cave, 50,000 years before Fleming. There is another substance Neanderthals mastered. Birch bark tar. They used it as an adhesive to attach stone points to wooden spears. They had been making it for at least 200,000 years. In March 2026, researchers published something unexpected. They experimentally produced birch tar using the exact campfire method available to Neanderthals and tested it in a laboratory. The tar actively inhibited the growth of Staphylococcus aureus, one of the most dangerous skin and wound pathogens known to medicine. Every time a Neanderthal handled this resin while making a tool, they were coating their hands in a natural antiseptic. Whether they understood the mechanism is unknown. What is clear is that it worked. In May 2026, a single tooth changed everything we knew about dentistry. Found in Chagurskaya cave in Siberia. 59,000 years old. A Neanderthal lower molar with a deep, deliberate hole drilled directly into the pulp cavity. Microscopic analysis of the inner walls showed rotational microgrooves. Researchers recreated the procedure using jasper stone drills, the exact material found at the site, and replicated the same groove patterns exactly. This was not accidental damage, it was a dental procedure. The tooth showed wear over the drilled cavity, meaning the patient continued to chew with it for years afterward. The procedure worked. This pushes back the origin of invasive dentistry by 45,000 years. And skull surgery is older still. Trepanation, drilling a hole in the cranium to relieve pressure, appears in the fossil record as far back as 11,900 years ago. At a site in Morocco called Tafaralt, the bone shows complete healing. The patient survived. Survival rates for prehistoric skull surgery, based on healed bone evidence, exceeded 70 to 80%. In later pre-Columbian cultures, these numbers are confirmed. They were not guessing. They understood, somehow, that the membrane beneath the bone must not be cut. They scraped carefully, stopped at the right depth, and their patients lived. We have spent centuries imagining prehistoric humans as something less, simpler, more brutal, without complexity. The evidence says otherwise. A child survived a leg amputation in a tropical rainforest 31,000 years ago because their community refused to leave them. A sick Neanderthal chewed poplar bark for pain and found a mold that makes penicillin. A dentist drilled a tooth in a Siberian cave 59,000 years ago, and the patient used that tooth for years. Medicine did not begin with Hippocrates. It did not begin with the Romans or the Egyptians. It began much earlier, with beings who watched each other suffer and decided to do something about it. That impulse, to notice pain and try to stop it, is not a product of civilization. It is older than civilization. It is the foundation civilization was built on.